Hi, I'm Dr. Chris Forsee,
I'm Dr. Owen.
and we are the owners of Dental Care of Mid-Florida out in Sebring, Florida.
My dad started in practice here about 40 years ago, and then I took over his practice, say, 30 years ago. And the practice just grew and grew and grew until I needed a partner. And luckily, I met up with Chris. And this has been about 13 or 14 years ago. And we've grown our practice for 30 years.
So I came from Kentucky, moved to Florida. I'm a transport. Practiced in Key West, Florida was my first stop as a Floridian. Practiced there for about 5 years. Risk of storms, so down there is severe. So my wife and I began looking for a safer, more responsible place, and Ron and I met up, and it's been a beautiful partnership since we met. So that's us. So our introduction to MB2 came about a year, maybe a little more ago. My wife and I, she sort of is manager, kind of the position in the practice. Um, she began looking around for options for us to make a transition. Dr. Owen is approaching retirement age. We've grown the practice in such a manner that it's not an easy transition for an individual to come in and buy the practice, and our accountant confirmed that we would most likely just have to work and close the doors. My wife discovered the DEO, which is the Dental Entrepreneur Organization, and we attended, and we had no idea what was going to happen, what was going to go on. So one of the groups that got up and spoke was indeed MB2 amongst other DSOs. MB2 was the one that stood out. We began shopping. We used Tusk organization. It's a partnership that helps to transitions and introductions into this larger corporate model. And ultimately, we decided that MB2 was the way that we were proceeding, and we ended up partnering with those guys. And we've been impressed with MB2 the entire time, not let down one time. So,
Yeah, Tusk helped us introduce us to about 5 or 6 different um, DSOs or DOBs, and it was easy to narrow down to MB2.
the one deciding factor for us, though, to partner with an organization like MB2 and ultimately MB2 was it gives the opportunity for our legacy, what we've built, to carry on. And we put a lot of trust in MB2, and we feel that this will remain part of our community because it has become such an integral part of this region out here, what we've built here.
So our future goals, especially for me, I'm an older senior doctor that I would like to transition out of here in about 5 years. But at the same time, continue to help MB2 grow the practice. So we set our own goals. They set some goals for us. But generally, we just come to work and work like we always do, and the goals will just follow themselves into our place here at Dental Care in Florida. And for me, the biggest thing is to be able to them helping me to transition out within a 5-year period.
So my goals with MB2 would be continue to, of course, grow the practice. We partnered about 13 years ago together. We've not had one single year where we haven't realized double-digit growths, and we don't plan on slowing that down. And we feel with the different things that MB2 brings to the table that we will be able to maintain that growth factor for our practice. Personally, for me, it gives me the opportunity to still do what I love to do. After he does exit, if he chooses to do that, and he may not do that. I mean, we're two different age groups. I'm not quite 50 yet, but it gives me the opportunity to still do what I do on a basis as I like to do it. It might be 3 days a week, it might be 5 days a week, but it allows me to carry on personally and have a team that, such as MB2, surround and support me and allow me to continue to do what I love to do.